All right. And the third work group we have is, is focused on ethics. And so Allyson is going to talk about that. Okay.
Oh, great. Okay, so, Neelum didn't want to come up. Okay. Okay. So I think my main point here is that we can keep the conversation going. So Neelum and I are covering the ethical considerations work group. And so we could be clearly part of AIM-3, where we provide guidance for how to disseminate and communicate blood biomarker results to patient populations. So what I mainly want you to take away from this is that we've got Agree Dementia. So a lot of you have attended our work groups. You can find us through agreedementia.org or .com. And the focus is on bringing together people who use dementia risk evidence. And I use that word because we include genetics, digital biomarkers, whatever risk evidence is relevant. And so Nina Silverberg initially envisioned this group. They have all these data and there are all these ethical issues and what do we do with it? And then Neelum identified a very helpful infrastructure, which I'll describe. But it started with mainly NIA center people. And so that a lot of us have stayed involved. I'm part of the Stanford ADRC, even though I'm based at the VA. So this is our structure. And we really struggled because the field is changing so fast. So what are we disseminating? What are we educating about? And so ADAC is just fantastic for us because now we'll have information to let people know about it. And something I've said several times is, what do you want clinicians to know? So that's, I think, what we're going to be looking for from the ADAC. And then we have an asymptomatic group that people living with asymptomatic biomarker positive risk information. We have a symptomatic group. I think Corey got one of the pilot awards. And then Neelum leads the diversity group. We have Sarah Walter. She's at USC and is a leader in clinical trials there. And then I do the ethics and law. And we partner with groups. So Neelum and I will be liaisons to ADAC, and then Jelaine is also part of our group, and then Mary join us, and Catherine, they work with Jelaine, and then we'll invite all the Agree Dementia members. So when someone attends our meeting, we say, write your name on the list of people who would like to be part of us and tell us what you're interested in and what your expertise is. And so I encourage everybody to go to that list. There may be collaborations I don't even know about, but you can find a lot of really great people on that list on our internal drive. So we partnered with the Global CEOI, and so Chi and Michelle led this working group where they looked at implementation in the use of blood biomarkers. And so this is one of the patient journeys, a simplified one, where we worked with them. And then we have monthly all-hands groups where the collaborator can present to us updates every month. And that's where people can weigh in. You get hiccups, we can give you feedback. And then there were two other working groups. One of them is to develop patient-facing information, and I looked at their website, I couldn't find it, so we should find out what they already have developed, but I know they were working on that. And then Suzanne Schindler co-led the other work group that looked at how good does a biomarker test have to be. So given different prevalence rates, what context of use, what sort of precision do you need? What positive predictive power, negative predictive validity, do you have? And so that those 3 papers, 2 from the implementation group and then 1 from Suzanne's group, are submitted as far as I know. And I think that's the information that we'll disseminate. But, again, it's constantly changing. So what's really fantastic about your group is you're going to have an ADAC website, and the information will be there. And ideally in a way that we can take the text and that an average person could understand. Or Suzanne has an algorithm. If you're this age, if you have this cognitive score, then you have this rate of conversion. She has some, so you could have algorithms there that we could make available and publicize. So just some other stuff. So you saw about our decision aid for blood tests. So that built on work from a pioneer in this area, Jen Lingler. So she at Pittsburgh has the PET imaging decision aid, and then she has an infrastructure where there's a lot of different options, feedback tools for what do these results mean. And so those could be, depending on what CEOI did, we could use what she developed there. So that's at Pittsburgh. And, in the early days, we had conversations of, but people don't want me to disclose this. So that really was one of the early studies in my feature in the Journal of Alzheimer's Disease. So what I've seen over the years is that when there's innovative techniques, technologies, there's resistance to it. And so what I do is I quietly go to people behind the scenes and I say, okay, I see you're having trouble. What can I do to help? And so, for example, if there's a solution that you think will advance the field, I think really we need to articulate very clearly what are the concerns, because sometimes they're so expansive they hold the entire field back. And then what is the specific solution? And sometimes your institution might be very resistant, but another institution may be doing that. And so we say, okay, so-and-so's doing it, let them write a response to your solution. So for example, delaying release of results. So the biomarker results come, there's an implemented delay at WashU, we can say, okay, so-and-so wrote this about this, they're doing that at WashU, we can do it too. So that really helps. I've really studied how can we move the field forward. And this is not, we had a forum where a lot of people contributed to this sort of issue from our group. One of the papers that I really loved came from Sarah Walter. So she's our stakeholder group leader and has a lot of people living with dementia and someone from the Lewy body disease organization. And they wrote an article called A Patient's Bill of Rights. Patients should have access to their research data. Cynthia Hewling-Hummel said, I've been in ADNI, I've had 10 spinal taps, I've been followed for a decade. Why can't I get my amyloid results? I have a diagnosis of Alzheimer's disease. And so she really wanted that Bill of Rights, and it's gotten a lot of positive feedback. But, one area is the research data that is of unclear significance. And so Lauren's presented to us, and it's on the web, her Alzheimer's Association project looking at disclosure of research results. So one project that we just completed, which I'm very excited about, is Malia Rumbaugh. She's at Indiana, and she co-leads the Dementia Working Group for the National Society for Genetic Counselors. And so she's probably going to write an update on using genetic testing in dementia, which is long overdue. But they developed a handout explaining to people why they need genetic testing for lecanemab, and then what are the ethical implications and concerns around that. So Stanford ADC gave us a little funding to do a survey in veterans, and they really want to be paid if they participate. So my research assistant, James, we surveyed 30 people, and there was this interesting interaction between likely cognitive difficulty, but comprehension and some of the feedback we got. So, for example, some people said it would be confusing to use the generic name and when they were getting the trade name, so not lecanemab, use Leqembi. It's more clear to them, and yet clinicians were nervous that they didn't want to seem to be advocating for Leqembi. So anyway, those are the kinds of things that you can get with surveys of stakeholders and patients. So I'm excited that you're going to be using ADNI. So one thing because I'm based at the VA, there's ADNI DOD, which has veterans information, and PTSD, which I think is important in disadvantaged cohorts. And so Mike Weiner is our imaging core director, and so he connected us with one of ADNI's users, and there's actually a biomarker for concussion being used by Raquel Gardner. So she's an ADNI DOD user, so that will be interesting. She's going to be studying head injury in older adults. Right now she's in Israel looking at blast injury in Israeli veterans. So let me see. Howie's here. And so I hope you've had a chance to meet him. He's got 5 primary care clinics that will be working together, hopefully with him integrating blood biomarkers. So those are some of the people. There are a lot more. We're multidisciplinary. I'm a neuropsychologist, so, come. We have monthly meetings, and then we have working groups that also meet monthly. If there's a project you want to do, if you want to present to us, we'd love to have you. I really appreciate Nicole's contributions to the symptomatic group. And then, Neelum, you want to tell us a little bit about we can do these webinars, and Neelum has also done some wonderful webinars.
Okay, thanks, Allyson. So if you haven't seen the website, please, if you haven't seen the website, please go on it and just see the information on the website. Again, it provides a framework for agreed dementia of how to handle some of these very, very diverse issues, and it's the same thing we're facing here with the blood biomarkers. So from the diversity perspective, there's a subcommittee of the diversity subcommittee. It was Monica Parker and Lisan Wong, and then Lisan got a very large grant for genetics in the Asian population. And Monica has a very successful program at Emory, where she has a brain health program, and she introduces a lot of things, lifestyle issues, risk factors, but also this biomarker discussions in that. What I'd say is that as we were putting together the diversity piece here for this agreed dementia, knowing that we're doing decision tools and all that, it was done, but it's really going to hit hard now with these blood biomarkers, okay? Because this is now for accessibility. People are going to come in these clinics. And as we were thinking about it for agreed dementia, we really were being very deliberate in where are we getting the message out and how many people should we reach? Again, inclusion, diversity. So the Center for Healthcare Innovation in Chicago is a non-for-profit organization that really focuses on diversity, everything to do with diversity, disparities, and frankly, equity issues. And they partnered with us so that we could do webinars and programming. And it's all part of the core work that they do. So we have an avenue where this can constantly, basically webinars and topic ideas can be put forward. And so I'd like this group to think about partnering again with them, but they also have a lot of network groups that they work with. It's a really important way to get the messaging out. It brings in people not just in medicine, it's bringing in people from pharma, from life sciences, from STEM-related areas, coming in to talk about issues that may relate. And in this case, blood biomarkers, I think, would be a great topic to talk about as it relates to brain health, Alzheimer's disease. And they are asking me that with this group, if we want to expand, just let them know, and we would be able to put together some programming quite easily. And this would be members of the group here and outside members. The other thing I wanted to bring up was, as you thought about the groups that we have right now, what other groups should we be including from the ethics here for this group? And one thing that Michelle and I briefly talked about, I think I ran it by some of you, maybe having a work group that's dealing with specifically health equity and some disparities issues that come in, so that it doesn't get basically thought about at the last moment of what we are doing. How should we include issues with that? And I think if anyone's interested in that, I'd be happy to talk to them, but I think something from a health equities perspective would be very helpful here, and bringing in experts in that area to kind of guide some of our discussions and help us as we start to move along. I think that's it for me. If anyone has any questions about the Agreed Dementia Group, again, Allyson has been instrumental in getting a lot of our presentations coming on a monthly basis. I can tell you from the diversity group in Agreed, we are always happy to have members, but what we're planning on doing now is reviewing literature and looking at studies coming out and papers, and actually looking at how much is being discussed in the papers that are being published as it relates to a lot of disparities and diversity issues when it comes to disclosure of our results. So that's the plan coming forward.
That's great.
Any questions for anyone?
Any questions? So, yeah, everybody's welcome.
Yep.